Good afternoon, everyone. I am Monica Payne, an ORISE Fellow appointed to CDC's Office of Public Health Preparedness and Response, Division of Emergency Operations. Thank you for joining us. I'd like to welcome you to today's Crisis and Emergency Risk Communication webinar titled Spokesperson. Today, we will hear from CDC's Lisa Briceño, who is a Senior Health Communication Specialist. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Please follow the instructions linked in your invitation you received. The course access code is CERC0912, with all letters capitalized. To repeat, the course access code to receive continuing education is, in all caps, CERC0912. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button at the bottom of your screen. The Q&A session will begin after Lisa has presented. We will now transition to our presenter, Lisa Briceño. Lisa currently leads the Emergency Partners Information Connection Team and the Emergency Risk Communication Branch, which oversees the CERC program. She has over 9 years of experience in public health and emergency risk communication. She has provided communication support during CDC's emergency responses to the Japan earthquake, Ebola, and Zika virus diseases, among others. She has conducted domestic and international trainings in the subject matter and supported multiple CDC spokespersons in their interactions with the media. Thank you for joining us. Lisa, please begin.
Thank you so much, Monica, and thank you everyone for joining us. I'd like to start out with a little bit of CERC background. So next slide, please. See, the purpose behind CERC, next slide, please, is to help spokespersons and others who deliver health messages in times of crises and emergencies to do so in a way that can help people make the best decisions that they can within incredibly challenging time constraints, and to accept the imperfect nature of choice. Rarely will we have all the information we want to make our decisions during a time of an emergency. So, using CERC principles, you can provide information in a way that helps people to make those decisions, the best decisions that they can, for themselves, their families, and their communities. Next slide. Because at CDC, we believe that the right message at the right time from the right person can save lives. Next slide. So let's take a moment to talk about what CERC is and what it teaches. CDC's Crisis and Emergency Risk Communication Manual was first published in 2002. Its purpose was to provide an approach to health communication during emergencies that is based on experiences responding to and communicating during public health emergencies. It's also based on the sciences of psychology and communication. Next slide, please. There are 6 core principles to CERC. Fully integrated, CERC helps ensure that limited resources are managed well, and it can do the most good at every phase of an emergency response. So let's first talk about the first principle, be first. We understand that in this day and age, with social media, phones everywhere that can record, publish, broadcast, that it is difficult to be the very first with information. CDC encourages you, therefore, to be first with the information that is your organization's information to provide. You can do this by preparing ahead of time, by being ready, by establishing relationships so that you can get that information out there when it is time to do so. But just as important as being quick to get information out, it's also important to be right. It's very difficult to change a message once it's been out there. So you need to be accurate with your first communications. If you don't have all the information at the beginning of an emergency, and you likely won't, then give information about what is being done to obtain more information. The third CERC principle is be credible. Honesty, truthfulness should never be compromised. Sometimes you may not be able to give all the information, but you can give reasons why you're not able to. You can say, for example, that you are still validating information. It may not be your information to give, and you may refer people to another source to obtain that information. Ultimately, however, you need to be credible in your presentation. Otherwise, it is difficult for people to accept your messages. Another way that you can increase acceptance of your message is by expressing empathy. Suffering should be acknowledged in words. When you acknowledge people's suffering, when you acknowledge the challenges they're facing, you build trust and you build rapport. CERC principle number 5 is promote action. When people take action, it helps restore a sense of order. It helps to calm anxiety and promote some sense of control over the situation. You should value the people with whom you're communicating as legitimate partners in their own care for ensuring that they stay safe and healthy, or as safe and healthy as possible in the emergency situation. Finally, CERC principle number 6 is show respect. This is particularly important when people feel vulnerable, and respectful communication promotes cooperation and rapport. Next slide. When we think about the CERC rhythm, we think about different stages in an emergency. Before the emergency hits, it's still time to prepare. It's time to draft messages and test those messages with the audiences that will be receiving it. It's time to develop partnerships and create plans for how you will respond when the emergency comes. It's also time to determine the approval process, because during an emergency, while you may have many messages already prepared, there may be new information that you need to share with your audiences, and it needs to be validated first and then approved to share with your audiences once it's been validated. The next phase in an emergency is when the emergency actually starts. That is certainly the best time to express empathy. Explain the risks that people are facing, but do so in a way that is easily understandable. That is not the time to give as much detail as you have, but you can refer people to where they can find more information if they're seeking it. You also want to promote action and describe what is going on in response to the emergency. Eventually, even though there's still much work to be done, you'll get to a phase, the maintenance phase, where things are starting to fall into more of a rhythm. That's the time to explain what the ongoing risks are and provide additional background information. If you haven't already, it's also time to address rumors so that people can receive the correct information that they need to keep themselves and their loved ones safer and healthier. Finally, life will begin to return as close to normal as it can. This may mean a new normal, but in any case, you'll arrive at the resolution phase of the emergency. That is the time when people tend to have a heightened awareness of that type of emergency, and you'll want to promote vigilance so that they can be better prepared the next time that sort of emergency hits. It's also time to discuss the lessons learned so that you and your organization and your partners can be better prepared to respond for the next emergency and to revise your plans. Throughout all of these phases, CDC encourages you to engage with the communities, to empower their decision-making, and to evaluate how you and your partners can work even better together to get information out so that people can stay safer and healthier. Next slide. As we said earlier, the right message at the right time from the right person can save lives. And today we're here to talk about how to identify that right person and how to help that person so that they can be as effective as possible in sharing information. Next slide. We'll talk not only about the qualities of a good spokesperson, but the role of the spokesperson in an emergency response, and some tips to help that person, whether it's you or someone you're supporting, to be able to deliver messages as effectively as possible. Next slide. So I'd like you to take a moment to think about what makes a good spokesperson. Perhaps think about somebody that you've seen that is an effective spokesperson. What qualities do they possess that helps them to be effective at what they do? While you're thinking about it, we're going to watch a short video, and I do encourage you to type your answers into the chat box so that this way we can see a little bit more about what your experiences are and what you're looking for in a good spokesperson.
This time. I will now turn the meeting over to Dave Daigle. Thank you, sir. You may begin.
Hi, I'm Dave Daigle from CDC Media Relations. Today, Dr. Ann Schuckett, the Director of the National Center for Immunization and Respiratory Diseases, will give us an update on the H1N1 virus.
Good afternoon, everyone. You know, we've been carrying out twice weekly full press briefings, and today we're just going to give you a little bit of an update. We know that a lot of people have been asking about a few issues about vaccines and antivirals, and so I'm just going to briefly catch folks up about the vaccine distribution and a little bit about antiviral use. We're expecting a more full briefing tomorrow with new epidemiologic data as well. I want to let you know that as of today, there are 24.8 million doses of the H1N1 vaccines that are available for the states to order. That's 1.6 million more than yesterday. And as we've been saying, although we aren't where we want to be with vaccine availability, we are seeing forward progress with more and more doses becoming available regularly. I know that it's hard to find in many places, and a lot of people do want to be vaccinated, which is great. I appreciate the frustration people are seeing as they are unable to find vaccine, and over the next several weeks it should become more easily available. And as I've been saying, each day we are seeing forward progress. We're expecting a lot of vaccination efforts this weekend in a number of places. I want to express my appreciation for the incredible work that the state and local health departments are doing in what is a challenging circumstance. We all had hoped to have more vaccine by now than we have, and so states and locals have had to adapt their plans about how many doses will be coming in the days ahead and where to have them delivered, about how to run those clinics. But as you've been seeing around the country, more and more states have been finding that they have sufficient doses to initiate school-located clinics and some other mass clinics, and as well many doctors' offices are beginning to get doses. So hopefully things will be getting better, but as I said, we're not where any of us hoped to have been by this point.
Thank you very much. So let's see what some of you had to say.
So I am Lisa's colleague, Kelly Waters. I also work on crisis and emergency risk communication, and I am looking at some of your really great comments and observations from viewing the video. Some of you have said that you think confidence is really important, and that is true. Confident speakers who are knowledgeable, who have rehearsed, who have planned their talks, and speak to all knowledge levels, meaning that they speak to people who may not have knowledge. And who are also able to speak to people who are at their similar knowledge levels and able to answer questions. That's a very good answer. People who are authoritative, who maintain eye contact, people who offer actions. That's one of our CERC principles. So good answer. People who express empathy. Again, another CERC principle. And also you recognize that Ann Schuckett, Dr. Schuckett, did so, that she expressed empathy and she gave credit to the state partners. Being able to recognize your partners as a spokesperson, you don't have to have all the answers. You can recognize the many players in a response, and you can also defer to those subject matter experts if you don't have all the answers. So you can work with other people to provide those answers as well. Sometimes it takes a village to provide those answers. Spokesperson should be well organized, should be reliable. So if you're going to provide an update, if you tell people, if you tell a community, if you tell the press that you're going to provide an update, to reliably do so when you say you're going to, that spokesperson should be articulate, should be well respected by the community. That's a very good answer. We have an entire chapter on community engagement. They should be honest, trustworthy, articulate, and calm. Calm is an extremely good trait for a spokesperson to have. Someone who is relatable. Also, as someone pointed out, the uniform that Dr. Shukit is wearing can lend to credibility. A point about that, sometimes it depends on the situation that you're in. When CDC was in Flint, Michigan, when Flint was requesting federal assistance with their water crisis, we were actually asked not to have our employees wear their uniforms because there was such a breach of trust with authority figures. So sometimes it depends on the situation. Sometimes that uniform detracts from credibility. So you want to read your audience. You definitely want to make sure that you know who you're talking to. But yeah, all of these are really great observations to keep everyone on task. I'm not going to go through all of them, but really, really great comments, guys. I'm going to turn this back over to Lisa. Thank you for your observations.
Thank you so much, Kelly, and thank you to everyone who contributed. We know that people who attend these webinars bring a wealth of information and experience, and it's great when you can share that with the other participants. So we have a lot of input as far as what makes a good spokesperson. Next slide. And one of the things that people brought up was being credible. It is so important to be credible, but how does one do that? Well, by expressing empathy and caring, you acknowledge what other people are going through, and you increase the likelihood that they will listen to and act upon your message. Competence and expertise were also mentioned. You can demonstrate competence and expertise through your education, through your position, your title. Sometimes the uniform can be helpful for that, depending, as Kelly said, on the situation. But also the experience that you bring to the response can help to establish your competence and expertise. And if for some reason you don't have all that experience, or you don't have the titles, or what you can bring doesn't necessarily resonate with the audience you're talking with, you can also collaborate and work with partners, and they can lend their expertise. They can lend the trust that they've built in the communities to help you establish credibility. As we've discussed before, honesty should never be compromised. So be as honest and open as you can. That doesn't necessarily mean providing every detail for all the information that you have all at once. As we mentioned in the CERC rhythm, there are going to be times to provide brief messages, action messages right at the start of an emergency, and then later on you can provide additional information. If you don't have all the information, provide information about what is going on to get answers. It may not be your information to share, in which case it's fine to direct people to partners in the response who can provide answers to their questions. Commitment and dedication are another way to establish credibility. State up front what your organization's objective is, and then commit to following up on that objective. Provide additional information as you have it. Provide regular updates when you're able to, including the successes and the challenges that the response is facing. Accountability is also important. Be as transparent as possible. Be transparent about how resources are being used, but also about the decisions that you make and the outcomes that arise from those decisions. Next slide. In an emergency, the role of a spokesperson is to take your organization from an it to a we. It's to help put a face on the organization so that people can better connect with you. So that they'll be more willing to accept the information that you have to offer, that they have more reason to trust that the information that is being offered so that they can act in their own interests. The spokesperson can help build trust and credibility for the organization, and they can lessen the psychological barriers, such as fear that people might be feeling, that can get in the way of them acting on the information. They can gain support for the public health response, and ultimately reduce the incidence of illness, injury, and death. If you are a spokesperson, or if you've ever had to present in public, you may have heard the advice, be yourself. While that can be good advice, as a spokesperson for an organization, it's much more important to be your organization and then be yourself. Remembering that what you say and what you do, including your facial expressions, including your body language, all convey something about your organization when you're serving as a spokesperson. You want to put your best foot forward so that your organization and the information it brings is received and accepted. Next slide. CERC offers some basic rules for spokespersons. First off, avoid over-reassuring. You may have bad news to share. You may not know how the situation is going to turn out. You don't want to assure folks that everything's going to be all right because you can't know for sure that it's going to be all right, and it certainly doesn't seem all right for them at the moment. You want to acknowledge uncertainty about the response. You want to let people know that information in the situation may be evolving, that you may have new information for them at a later date. We saw that with Dr. Shukit in her presentation. You also want to acknowledge fears and shared misery. As we mentioned, acknowledging how people feel can help you to connect with them, to establish a rapport so that they're more accepting of your messages. You also want to emphasize that there is a process in place to learn more. That also can be reassuring. Next slide. As you're able, give anticipatory guidance. Give people a heads up about what to expect, especially if it's possible that there could be some negative situations because of what is going on with the response. For example, if there's a medicine that needs to be given that could cause an upset stomach, make sure people know that before they take the medicine. Be regretful but not defensive, and express wishes. It is fine to say something such as, I wish we had more information at this time. Be willing to address the what-if questions. People are going to be asking them. And if you don't answer the questions that people are asking, they're going to continue to ask those questions and have difficulty receiving the information that you're offering them. Also, ask more of people and give them things to do. As we mentioned, giving people things to do helps them to calm their anxiety, helps them to restore a sense of normalcy and order. But research also shows that people are more willing to collaborate, to cooperate during times of emergencies. Next slide. Now, when you're working with the media, there are some things to keep in mind. First off, have a clear purpose for your interview. If you are the person being interviewed, see if the person who's organizing the interview can get that purpose ahead of time. That will help you be more effective in answering the interviewer's questions. If you're the person organizing the interview, make sure that you provide the interviewee's name and title. When you offer a title, provide a title that gives context. For example, you can state that the person is a medical epidemiologist, or state that they are the lead researcher on Project XYZ. That is definitely more helpful than saying they are, for example, the acting chief of such and such a branch. Before the interview happens, do a little research to know who will be conducting the interview. This will help you better understand their interview style, will also better help you understand their audience so that you can connect better. Anticipate the questions that the interviewer might ask, and be prepared to answer those questions. Again, you might not have all the answers, but you can provide the information that you do have. You can refer them to another source if it's really the role of another source to answer those questions. And provide them with supporting material. Because when you provide them with supporting material, they can walk away with a little bit more clarity, a way to check back to make sure they clearly understood what information you were sharing. But also, they can validate that information a little bit more easily. Next slide. Sometimes it can be a challenge working with the media. Do your best to avoid having words put in your mouth or leading or loaded language. If somebody does use leading or loaded language or try to put words in your mouth, you can rephrase in your own words using a neutral tone. It can also be tempting to continue talking after you've answered the question. Sometimes the interview will wait to see if you offer more. And while it's fine to continue to answer questions with your key messages, you don't want to get off the topic. You want to make sure that people clearly get the information that you're trying to share with them. Of course, no one wants to come across as confrontational, argumentative. So do your best to keep a neutral tone, even if the situation surrounding your interview is not neutral. Finally, avoid saying no comment. As we've said before, share the information that you do have to share. And if there is any information that you can't share, explain why you can't share it. For example, that data is still being validated. Next slide. In public meetings, as well as in interviews, it's important to practice self-management. You may need to do some slow breathing, slow, quiet breathing. You may need to be aware of your shoulders, your arms, your legs, and how you're standing. In public meetings, do let people talk. While you may have information to share, it is just as important to let people have their say. The more people talk, the better the chance that they will view the meeting as successful. Ask questions to make sure that you understand the situation. If you need to provide additional information, if you disagree with somebody's point of view, instead of using the phrase but, use yes and. For example, yes, we want to protect everyone's rights, and we want to make sure that people can stay as safe and healthy as possible while doing so. Even if it gets heated, respond appropriately and professionally. If someone makes a personal attack on you, try not to take it personally, but rather say, I'm here today to help resolve this situation, so let's talk about the issue at hand. Next slide. With any communication, you want to tailor messages to make them easy to understand. Even so, you do want to make sure that the messages stay consistent. So if you stick with your key messages and tailor them appropriate to the audience, then you will find that you'll be able to communicate more effectively. Gather feedback as well, in the moment and later on. For example, if you're in an interview, ask, did that make sense? Would you like me to explain? And later on, take a look and see what message did get out there. See if you need to reinforce your communication activities to push your message, to clarify your message. Remember that what you say is never off the record, even after the microphone is turned off. You probably are all at this moment thinking of somebody who thought the microphone was turned off and maybe even having a little chuckle at that. Coordinate and collaborate with other credible sources. This may mean having several spokespersons at the same event, ready to answer questions to step forward to the mic. It may mean referring people to those credible sources so that they can obtain more information when you are not the organization that has it. Meet the needs of the media. And we'll say that with a qualifier, to the extent possible. It may not be possible to have an interview, to grant every interview request that comes to you, but do your best to be fair in meeting the needs of the media and managing your time so that you can offer as many media sources as possible the information that you have to offer. Speak clearly with compassion and empathy. And after the interview is over, evaluate your performance. Take a look at what went well, what could have been done better, and what you might do differently the next time. Next slide. And finally, of course, we have a list of don'ts. Avoid using jargon. It can make it harder for people to understand. And if it's hard for them to understand, it's not going to be as easy for them to act on your messages. Don't use humor either. When people are in a crisis situation, it can be tempting to try and lighten the mood. But your humor, there's a really good chance that it won't come across as you intended. So just avoid using it. Do not repeat criticisms or negative allegations. Rather, state the positive of what it is. An example I like to use is, rather than saying, in case of fire, don't use the elevator, say, in case of fire, do use the stairs. Avoid expressing your personal opinion. As we mentioned before, you become your organization when you are a spokesperson for that organization. And do not show off your vocabulary. It can be tempting to use words that are more natural for an audience that is working at a higher level as far as their scientific expertise, their medical expertise, and it may be fine to use those sorts of terms for those audiences. But keep your audience in mind. As we said before, tailor the information you're presenting for the audience to whom you're presenting it. And with that, go to the next slide. Of course, we encourage you to check out the CERC website and all the resources we have there. We have different chapters of the manual. We have past webinars. We have additional resources that you can use. And if you have any questions about today's webinar, about past webinars, about any of the information you find on our website, we encourage you to write us at CERCrequest@cdc.gov. Next slide. At this time, we'd like to take your questions.
We will now transition to our Q&A session. If you need to ask a question, please use the Q&A chat button at the bottom of your screen. Haley, can you please read the first question?
Yes, so our first question is, what would be an example of asking more from people or giving them things to do?
Giving them things to do, one example might be washing hands to prevent flu. Asking more of people, you recall after 9/11, a lot of people were asked to donate blood. That is a sort of sacrifice that you could ask people to make. You can also ask them to, for example, check on their neighbors.
Thank you, Lisa. At the moment, we do not have any questions. Let's give people a few more seconds. All right, another question came in. What is a good time frame for the next briefing around the news? So I guess what would be a good time to update the public, or is it situational? What are your thoughts, Lisa?
That would be situational. If it is so fast evolving, if the situation is so fast evolving that you need to provide frequent updates, then several times a day would be appropriate. However, if nothing's likely to change, say between 8 a.m. and noon, then maybe once during the day, once during the evening. As the emergency evolves into the maintenance phase, you might even do it with less frequency, for example, every day or every other day.
Thank you, Lisa. We're still going to give people time to ask questions. So if you do have a question, remember to click the Q&A button on your screen and enter your thoughts. All right, we have another question. What might be the best approach to take if someone from your agency has spoken out of turn or given misinformation?
If misinformation has been given, it is important to, as soon as possible, come forward with the accurate information, with the correct information. It can be a challenge to get that out, but use every resource you have to get that information corrected, including contacting the source that may have published or broadcast that misinformation. Ask them if they would be willing to present the updated information. If someone has spoken out of turn, if what they've given is accurate information, handle that internally as much as you're able. But also then, as mentioned earlier, refer people to other sources when that's appropriate.
Thank you, Lisa. We have another question. In a public health situation with legal implications, for example, a quarantine, what do you suggest for the court spokesperson?
I would suggest that the court spokesperson limit the information that they have to offer to what is within the appropriate lane of that court spokesperson. I cannot provide legal advice, so I would suggest that you check with, if you are in that situation, to check with somebody who is more knowledgeable about the legal requirements for sharing information.
Thank you. We have a lot more questions. All right, so let's see. Our next one is, given the hurricane situation at hand right now, how would you word the importance of evacuation? This is helpful in an outbreak situation as well, informing people of how to keep themselves safe.
Okay, I apologize, but I'm not sure that I clearly understand your question. As far as evacuations, we do encourage people to always follow the advice of their local authorities. And if the local authorities were to contact CDC for guidance regarding messaging, we would, as we said, be direct and brief with the information at that stage of the emergency.
I can add to that. CDC is actually not typically the organization that is responsible for evacuation messaging. That's actually something that FEMA. when we talk about acting as a spokesperson, the spokesperson should always be speaking within their lane. And messages are something that the emergency management agency is typically responsible for issuing. So we would support that emergency messaging. When a hurricane situation is happening like right now, prior to the emergency, we issue public health messaging for preparing. And typically post-hurricane, we issue public health messaging for staying safe and protecting yourself.
Thank you, Kelly and Lisa. We have another question.
Before we move on to the next question, I would like to point out, and we can share that resource later, that CDC has recently published a book of messages, key messages related to hurricanes and flooding. And so if you would like that, you can either write us at circrequest@cdc.gov, or we can share that link later on in this presentation.
Related to that, we got a question I'm hoping I answer correctly. Do we have any pre-CERC messages available to use? We have several messages that are available for different situations that are already on our website. For example, right now we have CERC fact sheets that are on our CERC website, on our emergency website for hurricane. We have other situations that we've tailored for CERC on our website and our emergency website for other types of emergencies as well. And if you need help getting to those resources, our email address is at the end of the slide set that is on the webinar website. So if you're having any trouble locating those resources, please do email us and we can make sure that we can guide you towards that information. I'm hoping I understood that question. If we did not understand it, please send a follow-up in the questions and answers.
Thank you. We have another question. Is it ever good to have multiple spokespersons? For example, Chief of Police, Director of Health Department, or do you just select one person?
It is absolutely appropriate to have more than one spokesperson present for an event. And it will provide you more bandwidth to answer the breadth of questions that may come in. In a situation with your one organization, you do want to try to have one lead spokesperson, but definitely others can support that lead spokesperson as well.
Our next question is, does the level of emergency change how you frame your response? Are there types of emergencies where you would be more empathetic and others where you should be more factual?
No, we would encourage for any type of public health emergency, possibly any type of crisis, to go ahead and express empathy. You do want to, as a spokesperson, not just give information, but be a listener as well. And by listening, you can have a better sense of what people are experiencing and be able to express that empathy. Later on in the response, you don't need to start every time you provide information with an empathy statement, but certainly at the beginning of a response.
The next question is, what is the difference between a public information officer and a spokesperson, and how do they work together? A public officer can sometimes act as a spokesperson. Sometimes a public information officer can guide a spokesperson and identify a spokesperson for an agency. So an officer's job is to really kind of have an ear to the ground and know what's necessary for communications. And if a subject matter expert is identified as a spokesperson, they can help prepare them to speak, to comfortable in front of the media, sometimes the public information officer serves in that role. The conduit for information as well. If they are separated, is that these individuals really need to work closely together so that the public information officer has that subject matter expert giving the factual information, and the spokesperson, subject matter expert, has the communications guidance that they need.
Hi, Kelly. It was a bit difficult to hear that answer. Do you mind repeating yourself?
Sure, sorry about that. I hope you can hear me now. The question was, what is the difference between a public information officer and a spokesperson? And I was saying that sometimes that role is the same. A public information officer can sometimes serve as a spokesperson, but if the role is broken into two separate people, then the public information officer and the spokesperson would work really closely together. The spokesperson would provide the subject matter expertise, and the spokesperson would work really closely with the public information officer for their communications expertise. And I hope that's clear. And I'm sorry it was quiet.
Thank you. All right, we have some more questions. So this goes back to having multiple spokespeople. If you are part of a multifaceted response and there's several agencies that are represented, how do you avoid clashes between the spokespeople?
Ideally, before anybody goes forward to speak in a public forum, you would coordinate with the other organizations so that your messages can be consistent, that you would for example, if it's the health department would speak to health issues, whereas if it's environmental, the environmental department would speak to issues related to the environment, but you could share your messages between both organizations. And I think Kelly would like to add something to that.
Also, there is a lead organization for every emergency. There's a designated lead. So in a hurricane situation, it would be FEMA. For other emergencies, it may be a different federal organization. For state and local level emergencies, it may be a state and local organization. But that lead organization, it would be determined by them.
Thank you both. We have another question. What if the interview starts heating up with the media? For example, a reporter may get confrontational. What do you suggest to do to diffuse that type of situation?
In that situation, you may or may not be able to get the reporter to bring down their tone, but you can maintain your neutral, cordial tone as you share the information that you have to give.
Thank you. All right.
There's a question about what would be the best way to calm the angry people during
Public health crisis.
And can you guys hear me? And the best way sometimes to calm people, specifically if you're in a spokesperson role, is to listen. So
Many people think the role of the spokesperson is to simply stand up and talk and share facts, but the spokesperson's role is also to listen. The spokesperson is there to get information as much as to give information. What people provide for the spokesperson can help inform messaging, can help can help us change our messages. It can help us realize where our gaps in messaging are, what's working and what isn't working. So if people are getting angry, that can help us understand where what we're saying isn't working. If the spokesperson is there in front of people, they can listen on behalf of the agency. It's a huge part of their role.
Related to this question, if you find that people are aggressive or frightened, how do you help them listen to your message?
As Kelly mentioned, one of the first things that you can do is to give them a chance to speak. In a public forum, such as a town hall, it is a good idea in advance to make arrangements with a neutral party who can help manage when people are flagrantly angry. And you can, by giving them a chance to speak their mind, then you can help them reach a calmer place so that they could possibly receive your message.
Thank you. We have another question. And the person, Kelsey, says, I know there are deadlines for media and when their information has to be received to get out. How do you work with that to make sure that the most correct information is reported?
We do that by trying to keep our key messages as simple as possible. If you took a look at the resource that I shared with you via a link, you'll see that it's quite lengthy, and we wouldn't recommend something like that to publish that in its entirety, but you could draw from that to get some simple messages that you could share with the media, because the less complicated the message is, the more they're able to report it simply in a way that people can understand it.
Thanks, Lisa. We have another question. How do you recommend monitoring social media rumors and misinformation? And when you do find these rumors or misinformation, how do you recommend processing them when they're found?
There are a couple of approaches to addressing that. First off, as far as monitoring social media, there are many tools available, some for purchase, some for free, depending on what resources you have. But I decline to mention anyone specifically by name, as far as brands go, but there are lots of resources that you can use to get a gist of what the conversation is in social media. When somebody does put misinformation out on social media, often CDC does not find that they need to be the first ones in refuting it, but rather other people come in. There are times when CDC, when it looks like harm could be caused by that misinformation, that CDC might speak to it directly, but otherwise we generally tend to counter it by doubling up our efforts to share the accurate information.
Thank you. Here's another question. In a situation where a different organization, not an individual within your own, may be providing inaccurate information and doesn't have the authority to speak on that topic, how do you recommend addressing and correcting that information?
If that organization is part of the response, then you could work within the response and the channels within the response to address that. If that individual is outside of the response, they really are free to say what they want to say, and what you can do is use your best efforts, apply all the CERC principles, apply all the clear communication principles so that you can share information that will be received. You can also work with trusted spokespersons so that they share that information and it may be better received by the audiences with whom you're trying to communicate.
Okay, just a couple more. All right, does CDC have a database of initial templates for spokespersons to use talking points, press release items, Twitter briefs, based on standard types of incidents, like winter storms, hurricanes, earthquakes, wildfires, etc.?
No, CDC, as far as I'm aware, does not have a broad gallery of those sorts of resources, although we do often have those sorts of resources in our on our media website. And so if you will write to us at circrequest@cdc.gov, we can share that link with you for what we do have.
Thank you. And our last question, is it ever acceptable to respectfully leave a press conference once you're done delivering the message?
Respectfully, yes.
All right, thank you. That concludes our Q&A session.
Thank you again for joining us for today's webinar. If you have any additional questions, please email them to circrequest@cdc.gov. As a reminder, today's presentation has been recorded, and you can earn continuing education for your participation. Please follow the instructions linked in your invitation you received. The course access code is CERC 0912, with all letters capitalized. Thank you once again. Have a great day. Bye-bye.